today we have very special guests and distinguished guests today with us. Ambassador Pradeep Kapur with us, and we have Dr. Joseph Chalil with us, and he's also a chairman for the IAPC, and he's a professor in the University of Florida. So they are here with us to share the information about their book they have written. They co-authored it together, and so the name of the book is Beyond the COVID-19 Pandemic. So it is a different book and a unique book, and with the input from the doctor and input from the policymakers. So we will know more about the book, and they have a launch tomorrow. So we will know a little bit about the book from both the authors. Welcome to the show, Ambassador Pradeep Kapurji and
Thank you very much.
Dr. Joseph Chalilji. How are you?
Thank you very much for inviting us.
Thank you, sir. So we also have Dr. Bisham Singh. He will be joining in a minute or so. But I mean, Ambassador Pradeep Kapurji, I would like to know more about you and your journey in the policy making and the foreign policies. So a little bit, and then we go to the book, and we also talk about, Dr. Joseph Chalil, and then we'll go to the book, please.
Thank you very much.
Yeah.
I've been, fortunate in having had the opportunity and blessings to have worked in the Indian Foreign Service for India and for India's relations with many countries of the world in different continents, including Africa, including South Asia, Southeast Asia, Europe, Latin America, North America. So 35 years, more than 35 years. I finished my IIT Delhi studies as engineer, graduate, BTech, electrical, MTech, systems and management, and joined the Foreign Service with an All India rank of 32 in the Civil Services exam. I thereafter joined academics in the US, and I'm working as the Executive Director for Smart Village Development Fund with the Wheels Global Foundation, and also as Chairman of the diplomacyindia.com. I'm Strategic Advisor to Intellect Design Arena, and I've worked as professor in University of Maryland College Park, and I'm now visiting scholar at the George Washington University. So as the Executive Director of the Smart Village Development Fund, I was working here in Washington, D.C., and, I've been in touch with Joseph Chalil for a long time. And this pandemic, which struck the world, sort of was a wake-up call for, all the citizens of the world. So we decided to get together and do something about it, make a little contribution to the world. Thank you very much.
Very nice. Thanks. Dr. Joseph Chalil, how are you? Yeah.
Very good. So thank you
for know more about you, please. Yes. And also, sure. I'd like to know more about your Michigan, roots too. Your Michigan experience too. Yes.
Sure. Yeah. Again, as you mentioned to everybody, I am Joseph Chalil, a physician by training, originally from South India. Been here in the US since almost over than 20 years now. I came to Michigan. My first role was working for a hospital right next to you in Troy called Providence Hospital. I did my research there, my studies there. Then I was a fellow at Henry Ford Hospital. I joined the US Navy. I was posted in the Selfridge Air National Guard Base in Mount Clemens, Michigan. But Navy then, sponsored my business school education, fellowship in hospital administration, hospital management, and my interest in working with health policy, started ever since then. So I've done in hospital healthcare industry, in the business of healthcare for a couple of decades now in the country. And I see the situation we were in. This is not something which happened just because of COVID. The situation in American healthcare has been there, but it just got uncovered by COVID or got exposed by COVID.
Got you. The weaknesses and those kind of things. I got you. So, Ambassador Pradeep Kapurji, just we want to hear a little bit. How what made you to write this book, and give us a brief introduction to your book. And first of all, congratulations on your book, both of you. And then, Ambassador Kapurji, I would like to hear from you about the book, please.
Thank you. The inspiration to write this book was the fact that a pandemic struck the world, and the world was totally unprepared. So it was shocking for me as a, political analyst and as a policy maker earlier for so many decades with the government of India, to see that something similar which had happened in 1918 with the Spanish flu, uh, hardly any lessons were learned by the world to sort of prepare themselves better. So when we see the reactions of the world today in 2020, more than 100 years later, and then you read how the world reacted in 1918, you see a lot of parallels and similarities. In the sense, we don't seem to have moved ahead. We have so many advantages of technology, of every aspect of life, the internet of things, the artificial intelligence, the machine learning. So while the world has progressed so much on so many fronts, on this front we felt that it could have done much better for an issue where since World War II there has been nothing comparable which has impacted the entire global community and all the countries of the world, which is a much bigger impact than World War II, to have sort of impacted in such a massive scale in the world. So that is what inspired us to work on this book.
Very nice. Thank you. So, Dr. Joseph, we want to know. I mean, I know the COVID-19 has created a lot of chaos. I mean, stress on the health system. So, what is that? I mean, what was there before COVID-19, and how do you see? I know you mentioned in the initial introduction itself there is a weakness got exposed. I mean, by the COVID-19. So, what are the actual drawbacks as a physician or as a medical professional? And so, what would you like to say about America being an advanced country, and there are many other Western countries that are advanced? I mean, still, I mean, as Ambassador Kapurji mentioned that, I mean, it's been 100 years since we had a major pandemic, and we have more technologies, and we have grown in many other aspects. So, why is the healthcare system was not able to handle COVID-19?
It's a very interesting question. America is the one of the wealthiest nation in the world. We spend per capita almost $11,000 to $12,000 per person on healthcare expenses in this country, far superior, far higher than any other country in the world. But for some reason, our outcome measurements, in the sense, how long infant mortality, the measurements of basic health, we are not the best. It's because we are very good in certain things. We are very good in tertiary care, in the sense we are very good not in preventing diseases. We're not very good in giving access to care. So most people don't go for a well visit or annual physical exam in this country. But we do have the best cancer treatments. We do have the best transplant surgeons. We do have the best cardiac surgeons. But it's getting expensive because fundamentally there are a network of private hospitals who keep their pricing a very top secret, and no one knows exactly how much it costs. So it's a secret deal between the insurance companies and the hospitals, and ultimately the patients is the one who suffer because we don't know what the bill's going to be. So if you live in Troy, Michigan, and you have a hospital next door, or you can go down south to Detroit and go to DMC versus Royal Oak Beaumont to Henry Ford, but you don't know which one is cheaper, which one is better, because they're not transparent. Whether you go to your local hospitals in Michigan, whether it is St. John Hospital or the Beaumont Hospital or the Troy Beaumont or any of these hospitals. So our plan calls for, the issue here has been it's too partisan. The both political parties have set rules on, either you have to buy insurance for everybody or, let people have to pay for their own, but it's time we bring in some common sense into healthcare reform. We need to bring in some non-partisan reforms. That's what this book is all about. We talk about in this book on chapter 7, 8. It's all about how do we create a grand plan. We can learn lessons from our past, from how we built the freeways in this country 50 years ago. This was a similar timing when the economy was in shambles. We wanted to invest money into construction so that we can find jobs for people. We can very well do the same thing now. Instead of creating roads, let's build more hospitals. Pandemic, as you said, exposed that we don't have enough beds in New York City. We don't have ventilators. Forget ventilators. We don't even have masks or gloves, for heaven's sake. That's not acceptable when we are spending trillions of dollars in healthcare in this country. And then we are depending on foreign nations like China on exporting masks and gloves. That we need to stop that. That's what this book is all about.
We will come back to the few other points. Can you show the book again one more time, Doctor, please? I mean, it was glary. So yeah, you probably can hold it a little bit behind back. I mean, a little bit. Yeah, that'll be great. Yes. So it is Beyond the COVID-19 Pandemic. It's a book which is available on Amazon. So what you're talking about in this book is mostly what will it be, what it should be after once the COVID-19 settles down, and what should we know, or the government or the private sector should do to help the healthcare in the United States of America. So, I mean, that's very nice. Ambassador Pradeep ji, Pradeep Kapur ji, I want to ask you one thing. What kind of policies, do we have to avoid, these kind of pandemics in this world? I'm sure there are many organizations in the world. There's a lot of coordination right now, between the countries, and a lot of trade is happening between the countries, and there's a technology also there. So why were the policies were not able to control or avoid, the spread of this virus all over the world?
So I will discuss a little bit and then leave it for the readers to, get the book and read the rest of it and then understand it better, and then enter into a conversation with us and with different communities all over the world, so that there are better outcomes after these discussions. So the policies which are needed are to, firstly, you need leadership which is empathetic, which has a lot of empathy, which is able to dialogue with the people. The policies failed because governments all over the world suddenly realized that there is a more powerful enemy which is beyond their resources to tackle, to cope, which was a big shock for the governments all over the world. Even the most powerful country in the world, the USA, realized the same. So it is beyond the capacity of any government in the future to deal with such a pandemic through its own resources, which may be, nuclear bombs, which may be the most powerful weapons or most powerful technologies or science. But suddenly everything is dwarfed by this sort of pandemic. So till you are able to have joint actions, joint conversations, and joint movement and policies through use of social media with the people. So till everybody joins in these efforts, in future also it will not be possible. That is one aspect. There are various other policies we have discussed in the book, which I will just give a teaser now, because tomorrow we have the book release in the morning at 10 a.m. US Washington DC time. So I'd expect a lot of your listeners also to join into the program tomorrow for the book release, and also look at it in a little more serious detail when they get the book. We have talked about safety net, for example. We have talked about strategic reserves. We have talked about having mobile hospitals and trains and ships and planes, etc., for coping with these sort of situations, and many such more discussions about having, people from the retired generals from the army, for example, into decision-making teams and policy-making teams, so that there are better reactions. I'll stop here.
Yeah, fair enough, and we totally understand. You mentioned about, the logistics and then the policies and those kind of things. What we so you kind of said that the countries like USA is also not. It's a kind of a shock to them. So I want to ask you one thing. I don't want to go more details into the book. I know. There's a lot. There are 10 chapters, and then we have many detail. Every chapter has many more information. I totally understand. So what kind of role, UN has in this kind of situation? I don't want to more details, but is it, they did a good job, or was there any problem with that one? I want a simple answer.
Yeah, in 1945, what happened was the United Nations was born. Why it was born was because the predecessor of the United Nations, the League of Nations, had outlived its utility. So the world realized that it was not able to cope with situations like the World War I and World War II. So they needed a better organization. Now, UN created the World Health Organization and also created a lot of entities within itself to further augment the resources for tackling the health situations in the world. 1945 and now it's 2020. So in these years, it has performed well in some ways and not performed very well in certain ways. We have some discussion on that. And we feel that a time has come now for a rethink as to how to take the next steps for the future. So that is also discussed in the book. More details in the book.
That is true. Yeah, that's fair enough. That's fair enough. Dr. Joseph. So coming to the healthcare, this thing. We see you mentioned about the failure in the healthcare system in the US. So why, and also mentioned about the costs involved in the different hospital systems. And so why is it the basic facilities, are not able to, we are not able to provide? We are spending, according to your book, some trillions of dollars are being spent in the US. But still we are not able to provide, basic healthcare to the citizens of US. So what do you think? What is, and I don't want the detailed plan, just overall outline. What is that takes for a country like US to give basic healthcare to their citizens?
Again, all the plans have been in the past. I know we discussed detailed in the book. This is 276 pages available on Amazon now, and free on Kindle Unlimited. For people who are subscribing like yourself, is that the basic premise of the healthcare in this country has always been about how do we insure the patients. We insure the uninsured or the low-income people with Medicaid. We insure the senior citizens through Medicare, now through privatized Medicare plans, and everybody who are employed are given insurance through their job. So the focus has more been about insurance companies and how they negotiate prices and how the premiums are paid. And it's a cat and mouse game of how the insurance companies make more money, who is in charge. Is a doctor in charge or insurance companies in charge? Who decides which medicine you take or how many days you stay in the hospital versus what procedure you go through. It's covered, it's determined by insurance company and what's covered for you. We need to take that equation out. And if there are there alternative templates? That's what we talk about in the book. Does everybody need to be insured to have coverage? To have a basic cover, like to have a well-visit coverage for anyone, to have a cancer screening, to have an annual physical. If you are diabetes, if you have hypertension, if you have obesity, do we need insurance for it? Can the government provide it such a way that it's cheaper than providing insurance? While at the same time, how do we make our existing hospitals better? And how do we make our existing insurance companies better? And how do we decouple, in effect, employment from health insurance? Imagine what's going to happen if the insurance is not linked to employment. You can freely leave your job and take any job you want, and that insurance will be like your car insurance or your homeowner's insurance, where it's tied to you. And you have a basic plan which is covering you by the government. You don't have to worry about losing your job. You can take risk, start your own company, start your own radio station, start your own IT company for that matter. Imagine the boost that will cost. Again, we talk in detail in the book regarding all these plans, from basic restructuring of the entire health system here, building a lot more capacity. You mentioned in an earlier question, how do we prevent a pandemic in the future? I'm not sure we can really prevent the pandemic. The pandemic is there because it's a new pathogen, a new virus. We just don't have a treatment for yet. So the question is whether the pandemic was naturally occurring or was it artificially tinkered up. We don't know that. If that, even when that is, it's not a question of whether we get another pandemic. It's just a question of when we get the next pandemic. Will that be a COVID 2020 or COVID 2021 or whatever the next one may be? But how do we prepare for that? We need to have excess capacity. We need to have all these things which talk about in the book so that we can be ready, whether it is a pandemic, whether it is a natural disaster, whether it's a calamity or a war. Situations are same. Only difference might be that in a pandemic, it doesn't discriminate among age of the people versus a war where young people die. A pandemic we have a multi-trillion-dollar military. We couldn't protect our own president, from getting sick. Canada couldn't protect the Prime Minister of Canada, and London couldn't protect the Prime Minister of UK. So unfortunately, all our trillions of assets in military and defense mechanisms and healthcare spending we have created failed to protect our leadership. It's time we rethink the way we manage our healthcare and what do we plan for future. So do we want to start a discussion? That's all we want. We want to have political will. Both parties come together and create a common sense reform which prepare the countries, not just US. This is a template which can be copied elsewhere. This is template which can be copied in India, which can be done in Europe or in Asian countries or South America. Same thing. The plans, what we say in this book can be replicated, but we can be ready for the next pandemic if and when it comes.
So you mean to say you're suggesting, different plans in this book, how different models, so can you give us a high level model? We don't want the details. Is it kind of anything, what are you trying to propose, with the current situation for the US citizens, or what exactly your plan is? I know we have many plans from many politicians.
Several pieces to the puzzle. This is a complex problem, and every complex problem has complex solutions. It's not just one cookie cutter solution which meets everything. So we have created, 2 chapters on it, chapters 7 and 8. It's a grand plan, for healthcare, whereby we set up, multiple payer systems, different hospitals, access hospitals, county hospitals. We talk about how do we change the way we buy products. How do we manufacture products? How do we buy pharmaceutical products? How do we manufacture? Where do we manufacture? We talk about how do we create the manpower to manage all these clinics and hospitals. We talk about the hospital ships we have currently with the Navy. What about we create a lot more of it? Be ready for it. How about UN and WHO, whichever form that takes, takes a lot more of it. So again, as I said, we talk a lot about several plans. It is not easy to explain in 2 minutes. Again, as I said, it's 276 pages, but we try to explain in common man's language with examples so that everybody can understand that this people have a stake in it. Patients have to take charge. Ultimately, we have to make patient responsible for their own health. And we have to take care of health. This right now, we all take about is worrying about disease care. What we are taking care of. No one's paying you to go to gym. No one's giving you any incentive for stop smoking or working out every day or going to a doctor's office every year or every once a year for your annual checkup. Or if you have diabetes, who is watching your blood sugar? No one's checking that. So how do we incentivize the patients? So we have some plans, to incentivize patients to be good patients and then take care of their own health. So they have a financial incentive to do that.
Very nice. As you said, right in the book quiz, it's a very, it was not that hard for a layman like me. So, it's easy and I can easily understand. Only challenging part was the calculations. Where you mentioned about, how much percentage of each step. You have about 1.4% or 0.4%. Those kind of the calculations was kind of little. I did go back multiple times to understand what exactly it is. I may have to do one or two readings to understand exactly the other than that, the rest of the things are very, easy to understand. And to the Ambassador Pradeep Kapurji, I want to ask you, you being an engineer and also the policy maker, and I want to understand, in your book in chapter 6, you guys mentioned about, the technology, role of the technology in the future healthcare. So what can you give a gist of, what exactly you guys meant by, we don't want the detailed plan, but at least just overall outlook of the technology in the healthcare in the future.
So here I want to mention an anecdote. When I was the ambassador of India to Cambodia, we were coordinating the first India-ASEAN summit meeting, where all the 10 presidents, prime ministers, the sultans, and the Indian prime minister, so 10 ASEAN and 1 Indian, we were meeting for the first time at the summit level of the leadership of the countries. So there was a lot of discussions. Chairman was Cambodia, the Prime Minister of Cambodia. So I was the ambassador of India to Cambodia. So I was coordinating from our side. And a lot of discussions were taking place. So at the end of the discussions, our Prime Minister, Mr. Atal Bihari Vajpayee, was to give a response to the points which were raised by all these 10 leaders from these 10 ASEAN countries. So his comment was, Excellencies, if I answer all these questions now, what will be left to discuss next year? So everybody in the conference hall and in the hotel rooms we were watching on TV, there was a loud burst of laughter, and that is how the meeting ended on a very happy note. So I just want to narrate this in a sense. The readers will probably enjoy it a lot more by discovering for themselves what we have discussed about these aspects of technology and how it will empower them in the future. So I don't want to cheat them or take that enjoyment away from them. We can't hear you.
I'm sorry. Yeah, we don't. I totally understand. I mean, fair enough. I mean, only my point is, we don't want to actually understand. I mean, what exactly each piece of the puzzle is doing it. But I mean, as I said, technology is going to be a major role. We're going to play a major role in giving the affordable health systems to the people. Especially right now, the telemedicine has gone beyond. I mean, what we used to use, the way we used to use earlier. So things have changed a little bit. So coming back to another thing, I mean, you also mentioned about in the book, I mean, the logistics. I mean, you mentioned about the reference to the President Ford of the energy. So I mean, can you give anything, the analogy of reserving the oil to something else in medical supplies? I mean, I don't want the detail, but I mean, just a little bit of what you're trying to do here and what your book is about.
Yeah, so basically, instead of reinventing the zero, we studied the policies of the past and tried to see which were some of the best practices which have served the United States and other countries in the world very well. So we are drawing from some of those practices, like you mentioned about President Ford and the oil strategic oil reserves, etc. So that is what we have done. We have seen whether we can do something similar for pandemics for the future, in view of what we have learned in the pandemic and drawing upon earlier lessons.
Very nice. Thank you, sir. Thank that. Fair enough. Dr. Joseph, I mean, you being in the Navy, and it looks like you mentioned, probably I'm guessing it, the 33 has come from you. So I don't want the detail 33, what exactly the 33 is, and just give us one line or two lines about it, please.
Sure. Again, we talk about when the problem we've been facing when the pandemic hit was that many hospitals didn't have enough personal protective equipments like masks and gloves. Then we were running out of medicines. So and when the president of US is asking India to donate medicines to the country, to a point that America is stuck on foreign help. We cannot outsource our manufacturing, forever for healthcare. So we propose that we, in the book, learning from our military acquisition policies, that we need to manufacture locally a percentage of the products which are marketed here, especially medical supplies, and we need to start buying in American products. So this is another example. Again, there's not a lot of details given in the book about it, but it's gonna bring back the manufacturing back to the country, and plus we won't be troubled in the event of there's another natural calamity or a pandemic or a war. We're not depending on foreign countries to provide us, with bullets for our military, for that matter, or the planes for our Air Force. We make it ourselves. In fact, we supply the world, most of it. So we need to learn that. We need to. So there's a lot more information in the book regarding that.
Fair enough. So, Ambassador Pradeep Kapurji. So, I mean, your book, I mean, the solution in your book, I mean, how do you compare with I mean, is it only for the US, or are you talking about other countries also here?
So we are talking at different levels. We talk about the US, then we compare it with some of the policies and practices in countries like Canada, the UK. We have some in-depth discussions about India and the Indian systems of medicine also, and then we take it to the broader international level, the United Nations, the WHO. Thank you.
Fair enough. Thank you. And Dr. Joseph, I mean, is there anything which you want to talk about your book?
No, I would ask everyone to check it out on Amazon and on Kindle also.
We're not able to capture the
Okay, let me make sure.
Yeah, that's okay.
Okay. So again, it's available on Amazon worldwide right now on paperback. Tomorrow we have a charitable book launch. So most of the proceeds, or all the proceeds of the book sale, will go to charity, support worthwhile charities like the Wheels Global Foundation. It'll support PAN IIT, which is another association of the IIT Alumni Association. We also support the API, the Indian Doctors Association, which does multiple charitable activities like free healthcare clinics worldwide and in the US and in India. And also Indo-American Press Club to a point. So again, the proceeds go to charity. I would encourage all of you to support the launch tomorrow at 10 a.m. If you go into wheelsglobal.org, you can register for it. Please join in, please support the cause and learn more about take charge. Ultimately, take charge of your own healthcare. I know elections coming up. Both parties clearly don't have a plan yet. You can see when they answer questions. So maybe we should share that with them and see there are some common sense reform we can ask for in this country and just globally. This is not just for US. So thank you.
Thank you very much. So Ambassador Pradeep Kapurji, I mean, any final words from your side?
Well, the world is always a better place when we learn from history. What we are seeing is current history, in front of our eyes. Nobody who is living in the world today has experienced, or hardly anybody, let me say, has experienced this sort of catastrophe or calamity. So it's a very unique experience for all of us. We are somewhat lucky and blessed that we have the internet and we can, have this interview online, for example. We can work from home. The infrastructure is not destroyed. But to regain the strength of the soul and to regain our spirits, we have to get together and work together in conversation with each other for a better future. That is my request to the world.
Thank you very much, Dr. Joseph Chalil and Ambassador Pradeep Kapurji for coming on the show and sharing your thoughts about your book launch, and also for the cause. I mean, all the proceeds are going to the charitable organization. Very nice of you. Thank you very much and have a nice evening, sir. Thank you.
Thank you very much for this interaction. Thank you. Bye-bye.
Thank you, Sri, for having us. Thank you. Bye-bye.